This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Childhood obesity is a condition that negatively affects a child's health and well-being due to the excess body fats. The prevalence of obesity in most children makes it a serious health concern. This is evident from the fact that it has many adverse health effects on children. In the United States, an estimated 17% of children and adolescents are obese. Childhood obesity being a rare occurrence in the past, it is now among the most widespread health problems affecting children and adolescents. The changes that occur in the physical and social environments of the children add up to the causes of obesity. In mitigating the effects of child obesity, several stakeholders are involved, including state health agencies, family members, the community at large, and health plans. Problems of childhood obesity. Childhood obesity has several problems that it presents to the child. One of the problems that it poses to a child is that obesity increases the chances of a child getting pediatric hypertension. Secondly, childhood obesity can lead to a diabetic condition known as type 2 diabetes mellitus. Thus, an obese child risks getting this health problem. Another problem that childhood obesity brings about is that there is the risk of contracting coronary heart disease by a child. Another problem of childhood obesity is that obese children experience low self-esteem, hence affecting their relations with peers. In another context, social and psychological problems can be associated with childhood obesity as the most significant consequence in children. The problems of psychological toll on children can also lead to adverse problems such as drug and alcohol abuse, depression, and eating disorders. The most likely eating disorders that they might experience are anorexia and bulimia. Another significant problem associated with childhood obesity is the risk of having high blood pressure and a high percentage of cholesterol in the body. Other problems include skin infections, asthma, and respiratory problems. Solutions to childhood obesity. Childhood obesity problems have specific solutions that touch on all the stakeholders involved in a child's life. The stakeholders include the children, parents, teachers, schools, communities, civic leaders, and government agencies. On the part of the children, they can be a solution for themselves by learning good eating habits. The habits include eating lots of fruits and vegetables and making sure they are active most of the time by engaging in sports activities. The parents on their side should play a great role in limiting their children's time on TV and computer games. This is solely because spending more time on TV and computer games reduces physical activity. This affects the children through an increase in the consumption of high-calorie snacks. On the part of teachers, they play a vital role since they spend most of the time with the children. One important solution teachers can offer is a rotation between the classroom curriculum and extracurricular activities. This helps greatly in the children's learning abilities since active students are more alert and learn easily. Another solution that teachers can provide is having a program that raises awareness about physical fitness among both the children and their teachers. In addition, the teachers can have the children involved in healthy meal planning talks by inviting a health educator to speak to them. On the part of the school as a whole, they should have a coordinated school health program that is capable of addressing all the physical activities and nutrition. In this case, the health program should be able to integrate all the activities of a school community that influence a student's health. Amongst the components that it should integrate include health education, physical education, counseling, and psychological and social services. School authorities should also seek the indulgence of students in getting input to the school menu through engaging in focus groups or contests. On the part of the community, they can provide a solution to childhood obesity by increasing public access to places such as playgrounds, gyms, and walking or biking trails to increase children's physical activities. Another solution the community can offer is increasing access to a variety of food choices. Another stakeholder in the solutions to childhood obesity is the civic leaders. They can do this by making public facilities much more accessible. They can also engage city planners in establishing wider sidewalks and bicycle paths to reduce crowding and make them safer and more inviting. Lastly, government agencies have a role to play in reducing the problem of childhood obesity. The government can help create policies encouraging physical activities and healthy eating. Another solution the government can offer is through the allocation of funds for promoting health and monitoring programs. By providing teachers with health education materials, the government can help students develop skills, attitudes, and behaviors for healthy eating patterns. Conclusion. In the 21st century, there are several problems with health, social, and economic challenges, but one of the greatest is childhood obesity. The most significant health problems that we face today are due to the rising number of childhood obesity cases. Improving and intensifying the efforts towards promoting physical activity and healthy eating is a fundamental mission of both the parents and the community. Without a strong contribution from the community and families, we are not likely to reverse the epidemic. The community and families have the task of educating young people about eating healthily. This will largely help them become productive citizens who can make meaningful contributions to society. If you want to find more works like this research paper on problems and solutions to child obesity, head over to ivpanda.com. It has a collection of free samples with thousands of submissions covering virtually all academic subjects. No registration required to access it.